Hi everyone, let's talk about AGP procedures. Today we started doing AGP, so now we have an idea of the whole procedure, so I'm going to go through it step by step. First of all, when you start your AGP appointment, come in, get the patient in with your normal PPE. So your glasses, your normal waterproof mask and your visor. Talk to your patient first. Explain to them things, get their consent, and once all that is done, ask your nurse for the local anesthetic. While you're giving the local anesthetic, your nurse can then prepare the materials and instruments you need, so everything is on the surface, ready to go. Now, then your patient is numb, your instruments and materials are ready, then both of you and the nurse, you go out and you put your gown on, you put your mask on, your hair cover on, your shoe cover on, and your waterproof mask to go on top of your FFP2 masks. You come back in, you perform the treatment. Today we had an issue in the middle of treatment. I needed something that we didn't take out. It's a risk management that you have to do. So we hadn't done much of a drilling before, and we kind of thought what I need is very important. Oh, my nurse took her gloves off, she took the equipment out as usual, and then we carried on. So there has to be some sort of a risk assessment. We can't just stop the treatment just because we don't have a particular equipment. But all that should be prepared in advance. Also under AGP, please remember you can do anything. You can do your ultrasonic scaler, you can use your 3-in-1, water and air together. You can use your high speeds because you're fully prepared for it. So please remember that. The follow time starts immediately after the AGP has finished. So either it's after you stop using your drill or the 3-in-1. That's when the follow time starts. So please keep an eye on that so your nurses don't need to wait for an hour after your treatment to come back in. So now your treatment is completed. So normally, your nurse will take the patient out and show them out. But now she's fully covered in PPE and face mask. So this is the time she will not take the patient out. So you need then to take your gloves off, put new gloves on, text reception saying that we finished treatment, patient is coming out. So reception knows patient is coming out and can show them out. So with AGPs, nurse will not take the patient out and show them.
How to take off your AGP PPE. First, go to the door. First, remove your shoe cover. Like so. Then, remove your glove by holding there. Like so. Then remove your hair cover. And leave it here on the floor. When you take this off, take this off, and wash your hands. And now take your mask off.
And then make sure to wipe your mask. and you're done. The cleaning of the room. Your nurse will then clean the room. All the surfaces, wipe everything up as usual, and then she does her own doffing and then leaves the room. An hour after the AGP time is completed, she will come back in and she will start with mopping the floor first, and then once the floor is mopped, then she's going to clean the surfaces one more time so that all the surfaces are clean. And that's the AGP procedure.